The CDC is raising the alarm again about the measles after at least 171 cases have been confirmed in 9 states. The worst so far right now, South Carolina, with at least 124 new cases confirmed in that state since last Friday. The measles outbreak was the worst in the U.S. that we've seen in 30 years last year, with more than 2,400 plus cases. 11% of those patients were hospitalized. 95% of the cases this year are people unvaccinated. Joining us now, Dr. Saju Mathew, to talk more about it. Good morning, doctor, to you, and thank you. Talk about the cases right now where we're seeing the concentration.
Yeah, so Marni, the problem is we are at the verge of losing our elimination status in the United States. You see, back in 2000, measles was eliminated, but with these cases rising, as you can see there on the map, South Carolina is one of the cases where clusters of unvaccinated people are spreading this infection. And that is absolutely worrisome because while this is the most contagious virus ever, this also can be prevented by just getting 2 vaccines. The first shot gives you 93% protection. And if you get that second shot, Marni, you're up to 97% protection.
What is the risk to the vaccinated population when we see these cases spread?
Well, if you're vaccinated, then you're generally considered to be safe. The problem, again, is in the unvaccinated group or the under-vaccinated. Some patients may have only gotten 1 shot, so you're not fully protected. And as we get older, the vaccine can wane. That means it loses its efficacy. It's also why, as a primary care doctor, I recommend that patients talk to their doctor so we can check your blood work to see if you need a booster. But the highest risk are to especially our younger kids and people that are not vaccinated or protected.
What do you want people to know, doctor, about the measles itself, the symptoms, the dangers of this disease?
The symptoms are pretty straightforward. It's almost like you have caught a cold, upper respiratory infections, nasal congestion, fever, and then you develop a rash that starts on the face and then it moves downward. The fevers can be pretty high. The moment you suspect that your child or even an adult has measles, you want to alert your physician immediately. Obviously, you don't want to get on a plane. It's extremely contagious. Marni, this virus can last in the air for 2 hours. So if somebody walks into the room that's infected and there are 10 people that are unvaccinated, 9 out of those 10 people will catch the virus. And while most people recover from the virus, children can actually go blind, deaf, they can develop a pneumonia, and unfortunately, few children can also die in addition to developing a brain infection. So getting vaccinated really is the answer.
I'm curious, the CDC's new vaccine guidelines, how is that, in your mind, influencing vaccine hesitancy around this shot?
You know, we've been dealing with that for so long, and now with the new schedule, there's even more controversy. I think ultimately, just like anything else, you want to be able to communicate with your patients and address that elephant in the room. Vaccines all are not 100% protective, Marni, but you look at the risk-benefit ratio. The side effects from this vaccine may be just some pain at the injection site. Ultimately, it will protect your kid from developing these severe infections, inflammation of the brain, and possibly even death. So I think addressing that and having an open communication with your doctor is key.
Right, always. And real quickly, you mentioned the losing elimination status. What's the threshold for that? What are the markers they'd be looking at within the CDC or elsewhere to determine we've crossed that line?
You know, there's so many different thresholds and markers, Marni, but ultimately a simple way to look at it is 95% of every community must be vaccinated. So if you live in a small town, 95% of people in that town needs to be vaccinated or higher to prevent these infections from spreading. And if that status is eliminated, it can have negative repercussions for the United States in terms of travel bans and, of course, reverse the dangers of getting infected. So I'm hoping we don't lose that elimination status. The United States really enjoyed that since year 2000. But ultimately, if we don't get vaccinated, we are at risk of losing that status.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.